Governor Jim Pillen wants to slash roughly $150 million from the Department of Health and Human Services over the next 2 years. Thanks for joining us. I'm Julie Cornell.
I'm Bill Shamer. Today, lawmakers brought in DHHS leaders to drill down on specifics.
KETV Newswatch 7 Capitol Bureau Chief John Greenwald reports.
A slow-moving day in the legislature's Appropriations Committee.
Sorry, I have pages of questions.
Up for discussion, rural health, Medicaid, and the future of DHHS as it picks up part of the tab for Nebraska's budget shortfall.
What they are proposing are significant cuts to things like the Medicaid Look Back and other programs that are really essential.
DHHS has the target for roughly 30% of Pillen's proposed cuts over the course of this year and next. And on Monday, Director Steve Corsi leaned into that plan.
One of the things that the governor has asked us to do as department heads is to bring a running government like a business mentality into the executive branch, and I think we've been doing that.
Corsi touted consultative work with Epiphany, a company he used to head, saying it saved DHHS about $218 million a year.
And we have plans to save even more. In fact, you're going to see that the governor's budget recommendation.
What you'll also see is a reduction in the Medicaid retroactive eligibility period from 3 months to 1 month. This, as Nebraska is set to be the first state to implement new Medicaid work requirements. DHHS says that would remove 12,000 to 18,000 people from coverage come May. The plan would also eliminate several currently vacant positions and would strip $2.7 million from pediatric cancer research, a subject that provoked hard questions from lawmakers.
We say that the budget is a moral document. What is the message that you are intending to communicate to the people of Nebraska?
The Appropriations Committee will work together on its budget plan before it heads to the floor in March.
We're going to have very tough conversations about what are we prioritizing or not in the budget, and I don't think we need to compromise on Nebraskans' health.
Reporting for KETV Newswatch 7, I'm John Greenwald.